You're welcome back to the show this morning. As the world marked the International Day for Persons with Disability, the call for government and at all levels in Nigeria to revive policies designed to support disability inclusiveness in Nigeria has been resonated. All right, today we'll be looking at the topic, disability inclusion in Nigeria. How far, so far? We have with us in the studio this morning Ugochukwu Okeke. He is the state chairman, Jonapid Anambra State Chapter. You're welcome to the program.
Thank you very much.
And we also have Ifani Igwe, where Ifani is the secretary of the same union, that's Jonapid, Anambra State Chapter. Ifani, good to have you on the show.
Yeah, thank you so much.
All right. Quickly, let's start with you, the chairman, Ugochukwu. Let's look at when we talk about inclusiveness, just like I said earlier in my introduction, that has been the call, especially on the 3rd, where we commemorated the World Day for persons living with disability. Now, from your own assessment, let's look at Nigeria as a nation now. How will you assess the Nigerians, both the government and then the private sector, their inclusiveness when it talks about persons living with disability?
Yeah, thank you very much. Inclusiveness in Nigeria, I would say, has been improving from where it has been, because in 2019, yes, 2019, when Disability Act, came to be, things started to change. Because before then, we don't have a legislation that covers or protects the rights of persons with disabilities. But immediately the law came into being, so many things begin to change. Because the Disability Act has a provision of having a commission that will make sure that every provisions of that law are being implemented. And the assessment now will be based on that implementation of that law. So I would say that Nigeria, because of them having that political will, our president, to establish that commission, it is part of making things, giving persons with disabilities, access, to Nigerian governance by making things inclusive, by having a commission that takes care of persons with disabilities. That is part of the inclusion we're talking about. And that law itself has so many provisions. For instance, provisions of giving employment to persons with disabilities. And I would say that they have started to improve, because ever since then, good number of persons with disabilities have been employed in some federal institutions. Coming to Anambra State, the same thing. In 2018, Anambra State passed disability rights law. And that has transformed so many things. So many persons with disabilities have been employed into state civil service, workforce. And so many other things, like in transportation, things have been changing. In some states, because after the Federal Government Act being enacted, other states, continue to adapt the same law to suit the state. For instance, Lagos State, Kano State, Kogi State, Anambra State, recently Abia State, and some other states now started to domesticate the law in their various states. And I believe that it's because that the federal government has taken a bold step that other states now followed. So those provisions of the law have started to translate down to the states. And we have so many people in the states. Some people are now employing persons with disability, unlike before, because it is no longer a matter of charity. Now it has become a matter of right. And so many persons with disability have started to, taking part in governance. I could remember in Anambra State, some of us were appointed as given political appointments. In Anambra State, we have about 4 then. Then in some other states, they have been appointed, which are not there before. Okay? So, and that appointment has given opportunity for persons with disability to air their views, to become closer to the government. And they are now sitting on the same table of policy makings. Where, policies are being made. Because that appointment gives opportunity for them to be able to voice out what their needs are. And in terms of what I was justice, access to justice, Nigerians have started doing something different. Recently, Nigerian police made a provision that every of their will have disability desk. Even civil defense, I think about 2 weeks ago, launched their own, that every of their office must have a disability desk, which made it possible to have access to justice, which it is no longer, it wasn't there before. But as a result of this law, all these things are coming to be. Then in aviation, before now, persons with physical disability are finding it very difficult to have access to aircraft in terms of the staircase. But now they have started making provisions to get a lift that can now lift somebody on a wheelchair right away inside the aircraft without having any impediment, But I believe that it is with time. So many other things that are not in place will be in place because of this Disability Rights Act in place.
Gradual process.
Yes,
it's not going to happen in a day.
Exactly.
And we know that it's like a Herculean task because it just started and we have seen so much improvement, just like you have mentioned.
Yes.
But then it means that all hands needs to be on deck and we still need to do more. Now, let me come to you, Secretary. Let's talk about some of the challenges that have actually, facing people living with disability, especially when it comes to this inclusiveness.
All right. Good morning, everybody. Actually, I'm the publicity secretary, not the general secretary. Yeah. Yeah, so that I wouldn't take someone's position in error.
Okay, go ahead.
Yeah. Actually, the things we are talking about here, you see, one of our slogans is nothing about us without us. And talking about the challenges, it's almost every part of life, because when you talk about access, for instance, it's true that they are improving, like Nigerian government and the public are improving. But it's not enough for now. It's not yet enough until we see the changes. Until we feel the changes and everybody feel the changes, not just maybe people in the government or people that are in the urban area and all that. For instance, if you go to so many places today, that access, we are still finding difficult, especially people in the wheelchair, people on the wheelchair, crutches and all that. Because when your office is on the, let's say, second floor or third floor or something of that nature, you find out that, persons with disability cannot access that facility, no matter what their challenge is, no matter what the complaint is all about. They have to look for someone to go and complain for them, of which now, if you don't want to tell someone, automatically the message will not be released. The message will miss somewhere. Likewise, persons who are deaf persons, the same thing. Because in as much as there are sign language interpreters everywhere, but people are not making use of them. Yeah, people are not looking for them. People are not, accessing them. It's not that they're not accessible, but it's only when you ask. That's only when you will know that something like that is in existence. For instance, if a deaf person go to hospital to access health, find out that without sign language interpreter, you will not be able to access that health. Because you need someone to talk. You need someone to tell the doctor, this is what this person is talking about, this is what he wants to do, and the doctor will reply through that sign language interpreter. So you see that access to health is also a challenge as well. Even to we the visually impaired ones, anything print, we are still finding it difficult. In as much as there are some softwares that can help us to read something that is that is printed. But still, some of those softwares are paid softwares, paid apps, of which you know that economic Nigeria today is not smiling. So if you don't have money to pay, that means you don't have access to that. And Braille is not that common. Yes, it's common to with the persons with visual impairment, but for the public, they are not making use of it. For instance, if you go to outside country, for instance, you will see that there are some inception, there are some offices, there are some places where you come and touch maybe the inscriptions, and you see Braille inscriptions there, and you'll be able to read out whatever that is written there. Even some eye drug. If you want to know what I'm talking about now, go to pharmacy shop and get an eye drug. You will see that there is some Braille inscription that write the name and the way the drug should be taken. Okay. So, but in Nigeria, those things are not here. And for instance, access to ATM, that's the most painful one for we the visual impaired ones. It's not there. And in America, I'm sure of that. All their ATM machines has this braille dots. If you touch A, you will know that this is 1, this is B, this is 2, 3, 4. Yeah, just by touching. Okay. But in Nigeria, it's not there. And let me tell you, ATM is supposed to be talking. In America, ATMs are talking. And the simple truth, 70% of visual impaired ones have experienced this issue of stealing their money and all that. Yes. The reason is simply because they give somebody the ATM to withdraw for them. Yes. Because if you want to withdraw small amount of money, the bank will tell you go to ATM. Yes. And now when you go to ATM, you have to look for security or anybody, any random person you see there and give the ATM to withdraw for you. And after that, it's possible that the person snapped your ATM or something like that. You won't know. When you must have go home, your money will be missing. But if you have these braille dots in our ATM and also have this talking speech, JAWS, our phones are talking, our laptops are talking. So why ATM machine talk? So it's very, very possible. And I have seen it. I have seen sample in many places. So if you can have it in Nigeria, I think that access it will be improving, gradually, as my chairman said. Thank you so much.
All right, thank you so much. Chairman Ugochukwu, just like you had mentioned, he mentioned a whole lot of challenges that you're faced with. Now, as the chairman of JONAPED, now in Anambra State, I know that one of your mandates is to cater for the needs of people living with disability. So, so most of these challenges, how have you been able to, see if they can be addressed,
Yeah, thank you. And but before I go straight to the question, I want to add something to what my brother has mentioned. Another major challenge we are having in Nigeria is that we don't have data, accurate data of persons with disabilities in Nigeria. I know that that of data is not only particularly a problem to issue of persons with disabilities, it's general, but it's affecting us most because whereby there is no data, accurate data, planning for a person with disability will be difficult. So it is a major challenge. And another one is the perception of people. The way people think about disability issues. People are thinking that disability issues are supposed to be a charity issue. It is not. It's supposed to be a right issue-based approach. They're supposed to be using right issue-based approach to tackle every issue of persons with disabilities, so that they will no longer begin to see whatever they are doing to persons with disabilities as a charity. Because that is why some of us are where we are today in terms of development. Yes, so coming to your question, so we have been doing a lot. JONAPED Anambra State has been advocating for these changes. I remember that it is when we began to articulate our needs and making presentations to government that something started to change in the state. We took time to took census of our members that are graduates who have finished their school and they have no job. And we make a presentation to the stakeholders then we have Office of the Governor on Disability Matters. We made our submission to that office. The office now wrote a memo to the Chief Willie Obiano. And we have so many persons with disabilities in workforce, as they are being employed into workforce of the state, a lot of them. And we have been advocating, if we go to some hotels in Anambra State now, you will now discover that they have started to build ramps where somebody with wheelchair can easily have access to the hotel halls. Even the churches, we have taken our advocacy to churches. Bishop of Nnewi Anglican Diocese, Bishop of Catholic Diocese of Walker, and so many of them. We have taken our advocacy to them, and they have made it a policy that no new church will be built without having those facilities that will enable persons with disabilities to have access to the church auditoriums. So we have been doing a lot. And in terms of empowerment, we also help in training our people on various skills through the help of our supervising ministry, Ministry of Women Affairs. They are supporting us with funding. We train our people, then come back to them again, they will empower them. So, and by so doing, we are helping our people to be self-reliant, taking them out of the street. That's why if you come to Anambra State, it will be hard for you to see only Anambra with disabilities begging on the street. Some of these people we are seeing are not from Anambra State. So, and that is what our association is doing, to make sure that every Anambra with disability have one skill or the other to enable the person to fend for himself and to fend for people around him. Because time has passed when the person with disability, will be on the receiving end all the time. We are training them to know that they have that capacity of even taking care of themselves and even taking care of people around them, so that they will have value. Because why so many persons with disability don't have value in the society is because they don't have anything to contribute. But Anambra State Jonah PD is trying hard to make sure that we will build their capacity, we will make sure that they have something doing, so that they will contribute meaningfully to their community, to their family, even in the state at large. So that's one of those things we are doing. And the disability law is helping us to engage. In fact, that is the commission. Yes, commission is there. We thank God that we have a commission, but we have a lacuna in that law. Because after passage of that, after having access to that law, we discovered that all the commissioners, including the chairman of the commission, are being engaged on part-time basis. And for them working on part-time basis, there are some issues of persons with disability that we need constant attention. And for the fact that they are running the commission on part-time basis, we are yet to get all we are desiring to get from that commission.
Okay, let's look at the theme of this year's celebration.
Okay.
It's transformative solutions for inclusive development, the role of innovation in fueling an accessible and equitable world. All right, let's come to you now. This is the theme for this year's commemoration of World Disability Day. Now, how can we use this theme, implementation of what is obtained in this theme, to better the lots of people living with disability?
Yeah, actually, this theme summarized everything we're talking about. Because assuming this particular topic we're talking about, this inclusion, because if you watch this thing now, this thing even involves this inclusion we're talking about. So if this particular thing now, transforming solution to access and all that, can be implemented in Nigeria fully, not partly, or not just talking about it. Because when you talk about implementation, it's not just government. Like my chairman said, people's perception. If people can start seeing persons with disability as normal person that's supposed to be involved in everything, they're supposed to be involved even when talking about them. Because what we experience in Nigeria is people make policies for you, you're not involved, they just make the policies and give it to you, believing that this is what you want. Whether you like it or not, this is what you want. And our psychology, our normal Nigerian psychology, we always tell us that persons with disability just need rice and beans to eat, money, charity, and all that. We are good in charity. But in actual sense, that is not what we want. We want to have access to your house. We want to have access to those things we are having access to. Those things we are enjoying. We want to enjoy it as well. So if this particular team now can be, implemented in our heart, not just government, in our heart, you see that when you are doing, even as an individual, when you are doing anything, you will consider that tomorrow, my son, my daughter, my parents, my mom can join this persons with disability we're talking about. You will know that it's possible to put us in consideration in everything. So that is simple truth. Thank you so much.
Thank you. Ugo, let's come back to you now. From the news we read this morning, we noticed that this year's, in commemoration of this year, that people living with disability in Umueri, they organized first community-based observance. Now, why I said this is because I know that a whole lot of people with disability are living in rural communities and far to reach areas. So, as the head of this organization, what efforts are you putting in place to, bring these people together and help them also? Because most of them, it's very difficult for them. Yes. to operate?
What we are doing in Anambra State as an organization to make sure that we leave no one behind, more especially those that are living in the hard-to-reach areas, is that we made our structure in a way that it gets down. In Anambra State, we have Jonapid at the state. That is visually impaired, the deaf, the physically impaired. Chapters. After local government chapters, we have DCC, that is disability. To make sure that in all the communities that we have at least one or two persons representing our members in that community. So once we have an information, once we have a program, we'll cascade it down to the local government. Local government coordinator will now take it down to the communities through the leaders of those DCC. And that has been helping us. It has been helping us to network, with that. I want to know every person with disabilities in all the communities. It's out a program that know every person with disabilities. I told you that our problem is lack of data. So this every person with disabilities in Anambra State. And I believe that if we have a plan well for persons with disabilities, but because we will make it in a way that whether they are married or not, because we have a problem. There are some people that they don't have money or they don't have anything doing. We will know all these things. These are, and we also know those of them that have been, that have finished school and are waiting for employment, have not gotten job. We have their own data too. And we also look at people that are sick. We know the degrees of sickness that is affecting our members, because it will help our government to have a health policy for persons with disabilities. Those of them that are out of school, maybe as a result of no finances, it will also help us to tell government that we have also a number of people with disabilities that are not in school because of lack of finances. It will now help government to have a scholarship program for them. So these are the plans Jonapid and Anambra State have that will help us to make sure that the development we are talking about gets to the grassroots and every person with disabilities identified together with their needs.
Thank you so much. Ifeanyi, coming back to you now, a whole lot, because from what you say, if you have the data of people that need money, data of people that need skill acquisition, it's a huge one. And we know that the government cannot really do it all by themselves. Now, so I want to ask about your collaboration with NGOs, CSOs, and other stakeholders in our society. I mean, meaningful people that are willing to maybe be of help to these members of this organization.
Yeah, actually, Jonapid Anambra is not alone. Yeah, like you heard, it's an umbrella body that unites persons with disability. When you talk about persons with disability, we mean persons who are visually impaired, that is the blind, then the physically challenged one, the physical disability, persons who we call persons with physical disability, those that are using wheelchairs, crutches, amputees, and all that. Then persons who are deaf, and persons who are people we call persons with albinism. Yeah. So these are the four clusters that made up Jonapid Anambra State. Now, when you talk of collaboration, actually, we are not alone. It's true that government are helping, depending on their capacity and the area they want to cover. But when you talk about our institute, which is Jonapid, we are collaborating with some other NGOs like ROLAC. Most importantly, ROLAC, because this disability right law we're talking about, almost that, and let me say that ROLAC contributed 80%, 80% support in the implementation, because They started with us since 2017. Even when the law was not, in Anambra State, they, supported us in making sure that the law was passed, implementation, and everything, even up till now, they're still with us somehow. So what I'm saying that we are not alone. We are being supported as far as what we are doing is in accordance with what they are, also what they're also talking about. Secondly, when you talk about other other NGOs and CSOs in Anambra State, yes, we are having a very good time with them, like Christian Aid and many others. So that is the simple truth. We are not alone.
You
want to add something to that?
Okay. What Ifeanyi said, we have been partnering with civil society organizations in Anambra State. A whole lot of them. Mm-hmm. A whole lot of them. We are part of their meetings, and in fact, they are helping us to advocate for speedy implementation of the disability law in Anambra State. We are partnering with media, which ABS, where we are now, is number one, and other media houses, media organizations, and we are partnering with the churches. Because like I told you before now that some churches have made it as a policy. It doesn't start, they don't just wake up and make that policy. Mm-hmm. It is as a result of our partnership with them. We relate with them so that, and they have seen the need that those things must be put in place. So we are partnering with the churches, even the traditional rulers and the PGs.
Yes.
We are partnering with them, because this issue of having DCC, we can't work without having partnership with PGs. Both women part of them and the male part of them. So we are collaborating with them to make sure, and we will continue to collaborate because we cannot do it alone. So we will continue to collaborate with the PGs, more especially PGs, and the traditional. They will help us to identify our members in their various solved. We won't be able to identify them and know their needs. It will those private sectors will have a role to play, and we are not leaving roles so that all the government alone. So we are doing everything humanly possible to get everybody on board, to make sure, because what I normally say to people is that if disability has not reached you, it has not passed you, because it is, if everybody understand that anybody can become a person with disability anytime, any moment, if you can see that nobody will now take issue of a person with disability, lightly. Everybody will join hands to make sure that everything we are talking about, to make sure that life is easy. For a person with disability will be actualized.
All right. Right now we are going on a short break. Let's bring some of the things people in the street have to say about what we are discussing, because we actually went out to interview some of them, and these are what they have to say about the topic: disability inclusion in Nigeria. How far, so far?
Those people who are analyzed further analyze or something like that, or for me had educated. So all that they mother and again a position in the government. You understand? So that they can be able to help, encourage in the society. You got to go more that disability or something or part of the country. You got to go. So you could see them encourage. You have some places in some seats in the office, so that it will encourage others. Mandi nurture somewhere. See, Obarudu na naga school. Angwelo moko, angwelo maka mo ana ma force. Obarudu na naga school. But have for somebody in our office, who a disability person, you got to go on a role as a government worker. You understand? Okay, make him encourage.
It is necessary for the government, federal government, to build skills for them so that they will be trained according to their potentials. Then after that, they will be included in everything that is being done in this country. In everything. Because nobody born of a woman can never do anything unless if you don't want to utilize your potentialities effectively. The disability people, they are human beings, no matter that they have seen themselves in that condition. No matter what, they have rights to cast their votes. No person is supposed to send them out of the voting environment, because they are human beings created by God like us. They have rights to do everything in this country. Government need to create their own ministries. Even though some of them supposed to be appointed as officials of their ministries, they have to be incorporated in whatever federal government is doing in this country, because they are human beings created by our Creator above. They should not be neglected.
In before government, yes sir, these guys are not seen, but now they are seen, and hence they are seen among the hard. Yes sir. So they have organization, which my organization is partnering with them in some of the programs. It is very, very important that government come to their level. Yes sir. Any place you are building a public place, you must think first about these people. Yes sir, because it's important. Yes sir. And hence their vote counts. So you must think about them, they are putting policies. Yes sir. So I'm happy that their group is making some noise that they are now noticed. For the state that they are noticed, you guys, kudos to all of you that are doing the job. Yes sir, because it is something worth doing nice.
What is disability and several people in our society tonight? The government has done nothing about it. I was doing it for some years. I had this little meet the head of the albino group. They have albino group. They meet at the Backlund Hospital, I think they meet every Friday. And they are well organized. But the issue that they are not organized by government. They are trying to get involved in issues as well, but still nothing. So the way forward is, as I said, ministry, okay. Of course, it is necessary. Funny enough, most of that I've read said, I've seen the blind, the dumb. I have two another area. The man is dumb, the wife is dumb. Luckily, the children, mom is dumb. But these people are doing very well, are educated. So why not bring them in? Why call them out to vote after which you abandon them? So create something for them. In Bauchi, in Assad, they have their own home. They do all these baskets. It's like a school. They do everything, baskets, craft. And after they sell it to markets and they come out. So they can introduce the status.
All right, you're welcome back to the show. The people that we just heard their voices, they were just re-echoing almost everything we have been saying here, talking about the policies that will be made by the government, the stakeholders, and in fact the society at large to make the life easier for people living with disability. Now let's look at some of the innovative ways that the society, even the government, can create to make life easier for people living with disability.
Yeah, thank you very much. There are so many innovative ways government and society can, apply so that life will be more easy and meaningful to persons with disabilities. One of them is total inclusion. Total inclusion. And what I mean by total inclusion is that, like my brother did mention, that nothing about us without us. Mm-hmm. It is expected that persons with disabilities should be involved in every aspect of developmental processes. For instance, government, when making appointments, will create opportunity, a platform where persons with disabilities will be able to come in. For instance, if we have about 20 appointments to make, at least one or two should be reserved for qualified persons with disabilities. Because when they are employed, when they are engaged, it will now help them to sit on the same table with decision makers. That is only when they will be able to make input on what should be done to make life better for persons with disabilities. The other innovative ways are making physical structures accessible to persons with disabilities. There are some structures in the public place that are not accessible to persons with disabilities. Some offices that have 1, 2, 3-story buildings should make a provision to have a lift so that climbing those offices will be easy for persons with disabilities. And the issue of using sign language interpreters in the hospitals, these are the innovative ways. We know that we don't have many of them, but we can have a kind of a pool of sign language interpreters. Maybe have their direct, in fact, we have it in Anambra State. LOLAC helped to train them. LOLAC is rule of law and anti-corruption.
Yeah.
Then they help to train good number of interpreters, and they have developed a directory, where if you get to that directory, you can be able to call, on one of them, to give services where the services are needed. So it is an innovative way so that the hospitals should be able to have liaise with or have a synergy with Disability Rights Commission or even our organization like Jonapid to have a systematic way of having access to these sign language interpreters so that deaf persons in our community will have access to quality health services. And like my brother did mention also, there are some interviews that might be conducted for persons with disabilities and other non-persons with disabilities. It is expected that if such interview is being called upon, there should be a kind of...
You mean job interviews?
Yes, job interviews.
Okay.
It is expected that if you are inviting persons with disabilities and non-persons with disabilities for an interview, you should make a provision for persons with disabilities. For instance, if it is CBT, it's expected that those computers should have JAWS.
Okay.
It is expected that if there is no JAWS, if that visually impaired person comes with an aid that will help him to read out the questions, extra time should be given to that blind person.
Okay.
So that you can now be able to assess them equally. Because if you don't give a blind person who cannot use computer by himself because of lack of JAWS, if you give him equal time with somebody who is not visually impaired, you cannot assess them, their abilities on the same platform because the person needs some other, some other support. For instance, extra time for that person to be able to measure up with the other person. Then if you are conducting this exam, you want to make it in a way that it will be accessible to person using wheelchair. So these are the things. Okay. So these are the innovative ways, making structures accessible, putting us in a place that will enable us to make a contribution, in a decision-making table, and other things. So these are the things that when you do that, you can now see that the society will be equal to every other person.
Okay, well, we want to say a very big thank you to both of you for joining us on this show this morning. Thank you so much. I really don't have time because I know that you still wanted to say more, but there is no time again. We want to say a very big thank you to you, Ugochukwu Okeke, the State Chairman, Jonapid, Anambra State Chapter. Thank you for gracing.
Thank you so much for this opportunity.
Yeah? And also Ifani Igwebe, the Publicity Secretary. Thank you so much for joining us.
Yeah, thank you so much, and thank you to ABS, MD, and every staff in this ABS. You guys are really trying. Thank you so much. We really appreciate it.
All right. We want to say a very big thank you to you for being part of the program this morning. My name is Chidimma Oranwa. See you tomorrow. Bye for now.